Stand up for yourself, and I'll back you up. 'Cause problems don't solve themselves. I'll tell you what, instead of would or could, I think you should. Draw a line in the sand and stand your ground. It's for your own good.
Part of being a family and a family dynamic is holding ourselves responsible in a loving way for how other members of the family are doing. And it's such a unique, obscure situation when we see an identified person in our family who's dealing with substance use disorders, because we're not really educated. Where do we take them? Where do we start the process? Because right now, they're in one of the stages of addiction, active addiction. And it may be that they're not really ready to move over that chasm into what is the first phase of recovery. And that's what we're going to talk about today. Hello, my name is Roy Poyan, and I'm the Director of Families Impacted by Opioids and the host of The Voice of Families in Addiction. Today, we're going to discuss the detox phase, and we've invited Becky Paris, who works with Pinnacle Treatment Centers and Recovery Works, and she's going to help us better understand some of the characteristics of what is excellence. We picked Pinnacle because this is their focus. This is a group that truly understands and is highly ranked in their ratings with ASAM for their ability, their programs, their concept, and how they take our loved one and introduce them and bring them forward into the first phase of recovery. Becky, thanks for joining us today. I really appreciate you taking the time.
Thank you very much for inviting me. I appreciate it.
Well, we have an audience out here, and they're listening for the purpose of understanding they're in crisis mode now, and they're so frustrated pushing against this person, trying to convince them that you really have to go and start recovery. And we know that the first stage is to detoxify the body, what they commonly call detox. And so tell us a little bit about yourself and how you came into why you're doing this work, and where were you before this?
I have been in the industry for approximately 10 years. That's when I started my journey towards my professional licensure. I'm a licensed chemical dependency counselor level 3, which is the highest credential I could have without a master's degree. So simply put. So like I said, about 10 years ago, just life events led me to this decision. It's probably one of the best decisions I've ever made because I am from a family of addiction. So I see the impact, I live the impact that addiction has on families. Not only a chemical dependency, but mental health issues also. So when I was forced into a career choice, I'm so thankful I landed in this field. So I started out in a women's residential treatment program part-time as I had continued back to school at Cleveland State University to obtain the certificate that the state board requires, or complete the classes that the state board required. Completed those, was doing a part-time job, moved into full-time, brand new counselor, so a lot to learn about treatment plans, the biopsychosocial assessment, and then just the continuum of care for folks from the very beginning, which would be detox services. I did direct care for a while, then a wonderful opportunity became available to me. So for 4 years, I was the counselor on the opiate response team for Medina County here in Ohio. If the audience is familiar with quick response teams in their neighborhoods, it's the equivalent. So I worked with first responders for, as referrals came into us, folks that have overdosed in our community. We would go out and meet with folks and at that point assist them to get into detox services or to get back into treatment. If it was a one-time relapse or if it was a relapse of duration, then we would quickly assess, and then I would refer out to providers for follow-up care for these individuals. It was extremely rewarding. Sat at a lot of kitchen tables with family members, stood on front porches to discuss the process with family members for their loved one, and then would remain in contact with those referral sources that I had sent the client to, just to see what their progress was like. And I was required by my role to do follow-up, but once you go through, as a professional in this field, and once you go through this process with loved ones and you're there in their living rooms, it's experiencing their emotions, I couldn't help but be a part of it and long-term care for these folks. Mm-hmm. So occasionally I do see some of these referrals within our community, and it's just so wonderful to see how far they've come and how they've grown. And I do get emotional about it. But so anyways, that transitioned into some direct care again. But then I realized that I enjoy being in the community, I enjoy meeting these families, and I enjoy just spreading the information now with Pinnacle Treatment Services and Recovery Works.
Well, I think the audience could see why we invited you today to have a discussion with us. And that's an incredible, I want to remind everybody that when we're talking about the continuum of care, it's the continuum of your experience. And when we talk about continuity, we're talking about how do they couple? How do they link together? So those two words you'll find we're going to use today, but they're not interchangeable. Now, in regards to this situation, there was a time right before you showed up at the kitchen table that I'm sure was tumultuous for the family members. And at some point, something happened where they said, you're going to be here or we're going to meet with them. Did you often find yourself with the person who is experiencing substance misuse in the room when you're actually talking with the family about their options for moving forward?
Oh, absolutely, because the philosophy and my personal belief is this is a team effort. Mm-hmm. If you don't have the individual themselves, I can always work with the families because there's many different avenues to the beginnings of the individual's journey towards recovery. Mm-hmm. They can make that decision to go in for detox services to begin the journey.
Right.
Or the family members can make the decision to heal themselves. Even if their loved one is still in active addiction, they can start to heal themselves. But then hopefully, the thought process is that your loved one in active addiction, like that codependency has started to wane, or it's being cut off, and then the parents, the siblings, the dear friends, the spouses, the significant others, they're starting to heal where the client in active addiction is not. They're going to see how much better their loved one is doing, and hopefully that'll help them to make a decision that they need to start their recovery process also. So yes, they can be in the room with you, or they don't necessarily have to be in the room with you. That's one of probably the most valuable lesson that I had learned doing that response team work, was that how valuable family members are and how to incorporate them into this journey. But they have to be healthy also.
Wow. I mean, you're singing our song at Families Impacted by Opioids, and it's so refreshing to hear somebody else sing it besides me. But with that in mind, there's a lot of papers now coming out, probably a lot of studies that are ongoing right now that haven't really hit the publication trail yet. But I do believe that more and more people are seeing the value of, hey, families, you're so important to this process. If we can help you, that's what we're here to do. And so you learning, meaning you, the family, learning the process of the detox as the first step is going to be a very valuable step, because there's going to be a point, and we'll discuss the process in just a minute, where that person is going to sit there and say, am I doing okay? Maybe like day 3. And they're going to check in with the family. And what the family says is going to lay heavy on them as they start to approach the end of detox, looking towards, now I need to start treatment. Because detox is not treatment. They're 2 separate phases. Explain to me what I just said, if you would, in family terms, because you know both.
You just hit on a point that I routinely stress, and I not only say it to, and in my current role, I work with family members also, but more so with the client. But that is one of the things that I stress, is like, detox is not treatment. A lot of times, and well, folks will go in for detox, not feeling great for the first couple of days, but then they start to feel so much better, and they think, I got this. I can do this on my own. I'm going to go right back into that environment I came from. It may be supportive or it may be toxic. It's so individually based. That's why we require the biopsychosocial assessment done on all our new patients, so that our clinicians have such a better understanding where our patients are coming from. So going back into those environments can just be triggering, triggering, and then relapses occur, and long-term relapses occur. So no, I stress that detox is the first step, but our program, and a well-built program, in my opinion, would be you begin the process with detox, but then you work with your clinician, you work with your discharge coordinator at your particular detox facility, and clients will build their continuum of care and where they're going to end up, where they're going to go for their follow-up treatment, or to begin their residential treatment, their IOP programming, if it's PHP programming, and these are all steps through the process also. But, where are you going to go? And we don't want you to fall through the cracks. So for our programming, we provide transportation from our detox facility. As long as the individual completes our detox program, we will transport them to their follow-up facility for continued care, wherever it may be. So we're located in northeastern Ohio, so we utilize a lot of facilities in northeastern Ohio, if they don't remain with the Pinnacle treatment programming.
Mm-hmm. Well, now you've described a couple of things, and I just want to kind of go back into them, because I think that they're very valuable. I'm sure you do too. It seems that when they come into, they've got a bag of, a toothbrush and change of clothes, and you show them the room, and you make sure that they're hydrated, and you explain to them the program, and that for the next 3 days they're not going to be in a good place. What you're doing is what they refer to as medical monitoring in the beginning. Have you already done an assessment at that point, or do you wait until after a couple of days go by? How does that work? When is the assessment introduced?
Good question. Yes. Generally, the assessments are not the complete assessment, which could take up to 90 minutes, maybe a couple hours, just depending, because it's so individualized and all the information that the clinician is gathering. So that assessment wouldn't be done immediately, only because we know this individual is not feeling well. They're not at their best right now. So we need for them to start to heal physically, and some emotional healing going on also. So our clinicians, our nursing staff, our discharge coordinator, they routinely check in on our patients, our clients, and then when they feel like this is the best time to put them through that assessment, then they will. Because it's not serving anyone when they can't, your patient or client cannot fully answer the questions.
Right,
So
right.
that our clinicians can gather as much information as possible. So we know that individual, and then their treatment plan will be written on that information.
So in the psycho education portion of the assessment, 42 questions, but it's all, each question is there on purpose. And
Correct.
it has a weighted value to how they respond. In some cases, somewhat, never, 1 through 5, and they score it out, and then tally up. And I think what we need to understand as families is this is a empirically proven, meaning well-studied, a proven out science, behavioral science model that a group like Pinnacle is using. It's the best of the best. And that gives the advantage to both the patient and the clinician, because now they truly understand the characteristics, and each of these characteristics kind of fall like marbles into little columns, and one column builds up higher than the other, meaning it's more severe maybe in its current present state. And now they know, okay, we need to make this more of a priority in what we do with this person because of the weighted value and how they responded to these questions. This tool spans out an enormous, not just physical characteristics of their profile, but their mental health and some of the other areas of their mental health psyche. Is that correct?
Oh, absolutely. We are not a dual diagnosis facility, meaning we're not the substance use disorder and mental health.
I understand.
There's excellent programming out there for the dual diagnosed, but we do allow folks that have a mental health diagnosis, as long as they're stable
Right.
with their medications and they're working their mental health program, seeing their counselor, but yet addiction is still a very active part of their lives. So we can assist in addressing the addiction process, get them detoxed, and then back into treatment. But yes, because we're not but getting back to the assessment, yeah, it's such a valuable tool to get to know the individual. A lot of the questions that I get, so our detox is 7 to 10 days. I get questions, well, I can only do 2 or 3 days. Some folks don't even start to go through the detox process until 2 or 3 days
Right.
into it. So we're 7 to 10 days. I always tell my clients that up front, so they have that understanding. And then they'll be working with our discharge coordinator as to where they're going to go afterwards. I forget what I was going to say about that. Sorry, Roy.
No, that's okay. So is medical assisted treatment introduced at any point in the beginning stages, or?
Yes, our clients are medically detoxed.
Okay.
What that regimen specifically looks like, I'm not sure. I can't speak to that, but yes, we want our patients to be comfortable. That's our goal. We want them to be comfortable as they're going through the detox program or process, so that then they will become, in the hopes, active participants in their recovery program.
Describe for me, if you would, and I'm taking you back before they come to your detox program or anybody else's program, what are some of the things that you've seen that are common in what did the family have to traverse for themselves in order to address this? I'm sure that when you first meet, they kind of describe to you, this is where we've been. And then they describe what it's been like to get to this stage. What have you seen as a common path for families as they start to look at, okay, Jack, you really need to sit down with us and go through this? Have there been any kind of success stories that you can think of that help us to better understand that dynamic?
I think to put it most simply, my experience has been the frustration coming from the families.
Okay.
The families are
Demonstrating this, we're really angry.
sadness, frustration.
Yeah.
Maybe absolutely some anger. It depends on, getting back to it, so individualized. Really
Right.
depends on what their loved one has put them through, and
Right.
where they are. But a lot of fear.
Yeah.
They have, family members have so much fear for their loved one, and rightfully so. So that, they're kind of just at the end of their rope, simply put. nothing like a specific pattern comes to mind other than, what research what will say. But I just, listening to family members, the stories are always different, but always the same.
Isn't that interesting? I've seen that also. Yeah.
Yes, very much so.
Some of what I've seen is, of course, the denial. He should be able to will himself out of this, which is a lack of education on the family's part, not their fault, that this is a disease and that the brain has rewired itself. The neuronal firing is now using pleasure and the hippocampus to run its thought, and it's avoiding the frontal cortex, which is where the executive functioning is. And that's logic, decision-making, judgment, because it's bypassing and dopamine's being dumped at such a high level, that craving is enormous. So that craving has to be there when they're hitting you all.
I was listening to a podcast prior to coming here to do this podcast, and it was on, the topic was, our phones, social media, all that screen time that all of us are becoming addicted to, and what that is doing to our brain functioning, to our levels of motivation. And the doctor, the guest, or the specialist that was on, his comment was, you cannot break away from your screen time on willpower alone. Right. So here is yet another addiction where willpower is a part of it. Willpower does not serve and will not get your loved one out of active addiction. There's treatment, there's a process, documented and well-tested,
right,
that will lead to success. And there are multiple success stories out there. But no, you can't do it on willpower alone. And his best advice from this podcast was that replace that activity with something else that you do enjoy. Cut down on your screen time, but implement something else that you enjoy. And that's just like being in active addiction. It's like we want you to put down that chemical or alcohol, but yet replace it with something else that's going to be just as pleasurable for you, but obviously in a much healthier way.
And then so that our audience knows, because the question would beg itself, and thank you for bringing that up, Becky, is, well, how do they learn that? That's what treatment is about. That's what group therapies are about for the 16 weeks that they're in an IOP, or the 27, 28 days that they're in a residential program. They will be having group sessions where they learn those skills. That's not detox. Detox is a chance to separate themselves physically from the drug, in which case their mental rages at them. And you want to have a medical team with best practice protocols that are known to be helpful, and you need qualified clinicians. Now, I have a question for you. This is a zinger for you, so I don't mean to put you on the spot. But if I'm a family, how do I know, what questions should I ask a detox center so that I'm making sure I'm not getting, Joe and Harry's place of recovery over a pinnacle, evidence-based, highly trained clinicians on site, infrastructure?
Well, you can always ask for the staff's credentials, and SAMHSA requires that clinicians have a certain level of certification so that they can be direct service providers. And I believe, well, I probably shouldn't say, I think it's LCDC 2 level.
Right.
So,
okay.
But then, we have a director of nursing, we have a clinical director, we have our executive director. So those three positions, monitor all aspects, that
Right.
they have their departments of our detox facility. So you can always ask, what the credentials are, but the two frequently asked questions that I get, because I'm at the beginning stages.
Yes.
I get the
Yeah.
referrals, I get the phone calls,
Right.
or I do the outreach calls to speak with the individual in active addiction, and I'm trying to get them into detox. So two of the questions that I always get, well, I should say three. Are there TVs in the room? And we do have TVs
I
in
gotta
our
watch
room.
Dr. Phil.
Well, exactly. Well, this is still, indicative of a comfort level.
Yes.
You know,
Good point. Yes.
You know, and also, you know, like, is this going to be like jail? Well, we are located in a hospital. Our detox facility in northeastern Ohio is on the third level or third floor of University Hospital. So we're in a hospital, so it looks like a hospital.
Yeah, right.
But we do have, you know, there are bathrooms in each room, two folks to a room, TV. Can I smoke?
I hear that a lot. Yeah.
So yes, and sometimes I'll ask the client, do you happen to smoke? Well, yeah, I do. Can I smoke there? I'm like, yeah, you can. Okay, I'm picking you. You know, it's like, but not because, you know,
Can I
this
get
is-
Arby's delivered?
right. I mean, not because this is a sales tool, but we
Yeah.
also know that
That's
it's
their lifestyle.
and they will refuse to come to a detox facility if
Yeah.
they're not permitted to smoke,
Yeah.
because it's difficult to quit so many things at the same time.
Right,
So,
right.
but you're right, it is a lifestyle. So
What-
we do have that, and then transportation.
Yeah.
Like, how am I going to get there? Like, we provide transport, and we admit folks to our detox program 24/7. So these little examples that I'm sharing could be questions that you could have for detox facilities. Like, where are you located? What are there TVs? Do I get to smoke? You know?
There's different levels of intensity of a person that's going to come to you. He could be a severe substance use disorder, or he could be mild or moderate, but he still needs to go through, or she needs to go through detox. If I have a child or 2 or 3 children and Child and Family Services has not become engaged, but my family has certainly said they're not going to help me, what do they do with the child? I mean, do you offer any kind of case management of, okay, in order to get you so you can come here? I'm sure it's not often, but does that ever come up as far as how do I separate myself, even if it's just for 7 days, from what is my responsibility hourly with a group of, you know, family members?
It does happen. It comes up, you know, frequently for
Oh,
me,
okay.
and unfortunately, that's a huge obstacle.
Yeah.
And a lot of women are not getting services because of that.
That's terrible.
Because that's they're the primary care.
Right, yeah.
You know, majority of the times in these situations. I've had women delay their detox program until they could get care for their children. There's been times where I've assisted in trying to find child care for folks that are coming in for detox. And then getting back to the continuum of care, that would be a really important, that's important information for us to have, so we know that we can refer the woman to a facility that will accept her children.
Right,
So,
good point.
So that, I mean, it does nothing but support her journey of recovery, and then to keep them in programming, to keep them in residential treatment, IOP, PHP. So, but no, it's a huge obstacle. Pinnacle ourselves, we do not offer the child care, but you know, there are programs that do. So I reach out, and that's a lot of my role is the networking, is to try to find out what programming is in my community, so I could best serve our patients.
Yeah. That's an advantage when your community has, I know in Akron and in other communities around the Northeast Ohio area, they've got a group called Better Together, where a lot of the representatives of different types of services get together once a month. We become aware of each other's services, and that closes
That's where we met, right?
That is where we
Yeah,
met,
yeah.
right, at a Better Together meeting. I think it was in Akron.
Yes.
They do a fabulous job there. As a matter of fact, Akron does a fabulous job with a lot of grassroots. I mean, you want to talk about safety, that's the home of alcoholism.
Alcoholics Anonymous,
yeah, and Bill. So with that in mind, how about the LGBTQ community? Do you have a way of addressing some of their special needs when it comes to detox?
We do provide. Yes, we will provide rooms.
Yeah.
You know, when available, we will do our best to you know, make this process as smooth and as comfortable as possible.
Right.
So staff is aware. If I'm aware, staff becomes aware. And then yes, we'll certainly work with folks. our detox facilities are co-ed, because we're in a hospital setting, like one.
It would be on the floor of a hospital, sure.
Right, yeah. One hallway's female, the other hallway is male, but if female identify as male, we're gonna work with you. We're gonna see what we can and cannot do. But if we can't accommodate, for whatever reason, if we just don't have a room available, then we'll find you a spot. And just circling back to Better Together, is like that's the value of that programming, as you stated, is like I can reach out to other service providers and say, hey, I have the female identifying as male, vice versa. We can't assist right now, but can you?
Are there any certifications that Detox, like we're starting to see JCO accredit treatment centers and CARFT and some other groups that do accreditations for clinical service groups. Is there one for Detox specifically, or that's just my ignorance? I just don't know.
The only one I know, CARF.
CARF, yes, okay.
Yeah.
And in that, is it reasonable for a family to ask what the staff to patient ratio is?
I've never had that question asked of me,
okay.
because our bed capacity is 36.
Right,
So at full capacity, we're going to have 36 patients.
right.
And then
And how many staff then?
the staff, during,
16? I mean, how many typically?
well, Roy, I'm not quite sure.
Well, it varies, and I
Yeah.
and
A good question.
one thing I love about you, Becky, is you answer the question the way it's stated, okay? Because if you don't know, you don't try and fill it in, and I appreciate that, because I know that later you're going to tell me, because you'll follow up with me.
Well, the one thing, and Pinnacle is not the only company that's going through this, but in this field, we are short-staffed.
Okay, fair enough.
And sometimes it's difficult to
Yeah.
just find that perfect individual. So, ideally, what's that number? I don't know.
Right.
I'm unaware, but, we're just doing the best that we can.
Honestly, I think SAMHSA and other groups stay away from that too, for that same reason. It's a difficult marker to say this is the standard average that you should expect. You see it more in nursing homes, where that industry has been around for a long time, and they have different levels of nurses, STAs, and all.
Correct.
So, with that in mind, what tips would you give a family while they're waiting on this 7 days? Because I've had, in families impacted by opioids, clients on board where they've called me and said, Roy, they're mistreating my daughter, and they're just a terrible organization down there. She's crying on the phone. I'm going to go pick her up. And it's kind of like, Janet, we talked about this. We knew this was going to happen. Part of your education and training is that this was going to take place. So what tips would you give the family on the conversations that benefit the person while the person is in treatment, coming from the family?
Well, for staff or the patient to communicate with loved ones or family members, a release of information has to be signed.
Okay.
Because we cannot communicate anything. We can't even agree that a particular person is a patient of ours without this release of information signed. And that's up to the patient. That's not up to the loved one. When they go in, they're offered a release of information. Then they identify who they would like to speak with or who they want staff to speak with to give updates. So just so family members are aware, it's up to the patient to allow you to have this information.
Okay.
But if you do or if you do not communicate with your loved one while in the detox process, what I would stress most importantly is self-care. Whatever that looks like is while your loved one is in the detox program, take care of yourself. Because not only are they healing physically and emotionally, their brain is beginning the healing process. Physically, they're healing. But you need to do the same also,
Okay.
for a different reason. But you need to do that also. There are many programs, support programs, there should
Al-
be
Al-Anon,
in your
yeah.
in your community that you can access. Your church, your NA, or yeah,
Al-Anon, yeah.
Al-Anon, thank you. Programs like that, or if if you have a friend that can be a confidant, or if you know someone that's been through this process, I'm sure that they would love to support you. But most importantly is that self-care, whatever that looks like. If that means catching up on your sleep, being able to watch your favorite TV show without worrying about anything,
Right.
because your loved one is taken care of, or to seek some professional help also. I would highly recommend that, some professional, however that looks.
Oh, I agree. We strongly recommend that the families seek family therapy. On board a family therapist, this is a chronic disease. It's not going away. Just because they finish detox, now they gotta go into treatment. Recovery doesn't really start until after the treatment centers are done. The real recovery is done outside of the treatment centers. That's just an acute care setting for normalizing what has been a very, traumatic and impeding situation of chemicals being dumped into this person's body. So once we flush those out, they're not out of the system for a long period of time.
Right. It's a family disease. And I think my own testimonial early in this podcast, coming from a family of addiction, is indicative of exactly what happens. It's like, I grew up in that, but all these years later, I'm still dealing with it. I'm still processing it. So that's what happens to families. It can be generational. So take care of yourself. If your loved one is, beginning this journey, so should you. You deserve it.
I would agree. Well, is there anything that we didn't cover that you thought you might want to have mentioned or emphasize again during our discussion today?
Sure. I think my contact information will be on your screen, but real briefly, if I can explain my role with Pinnacle and Recovery Works, the difference is Pinnacle Treatment is the umbrella company. Recovery Works Portage and Recovery Works Columbus are our two detox facilities in the state of Ohio. My role is to take these referrals and then send them to our facilities, our detox facilities. So I'm at the beginning part of the process, but I can also refer out. If we have a conversation, family members, the patient, anyone can reach out to me, or even just a loved one or a neighbor that suspects that, this young lady that you saw grow up, but now you're thinking she may have a problem. I don't know whom to reach out to. Please, you can give me a call. There are so many resources in our communities that I'd love to refer you to and see how we can not only help you, but help your loved one.
Thank you. I think that that's important for us to realize that when we're looking at detox, ask for the liaison of that detox organization, because they are the ones that are trained in order to magnify the issues that are going to be most relevant to moving forward, because you're going to be dealing with a lot of topics all at once. And this is just the beginning of a very complicated journey to navigate. So on board somebody from the institution that you're dealing with that becomes your partner, just as Becky had suggested she would do for you at Pinnacle. I want to thank you, Becky, for taking the time today to meet with us on The Voice of Families in Addiction, a podcast that's nationally broadcast. And I would invite you to continue to follow us on our selected podcast sites. God bless and take care.
Stand up for yourself, and I'll back you up. 'Cause problems don't solve themselves. I'll tell you what, instead of would or could, I think you should. Draw a line in the sand and stand your ground. It's for your own good.